So the recurrent sinusitis with persistent asthma symptoms despite medical management can be used in these procedures. For this procedure. Next is the long volume reduction surgery, or the LVRS. So the LVRS is used naman for severe cases of emphysema, a condition often associated with asthma. So by removing damaged lung tissue, the LVRS can improve lung function and reduce symptoms. Last is the tracheostomy. So the tracheostomy in rare cases of severe asthma with respiratory failure is used. This is to provide a direct airway for asthma patients. So the severe asthma with respiratory failure that cannot be managed with other interventions is used for this type of procedure. So the surgical management should be considered as a last resort after exhausting medical treatment options. These types of procedures can be beneficial in certain cases, but they can also involve risks and may not be suitable for all patients. Now we will move on to the nursing management of asthma. So this nursing management are the key nursing interventions for patients with asthma, focusing on the assessment, education, and support. So first are the regular assessments such as respiratory status, conduct frequent assessment to monitor the patient's respiratory status, including wheezing, shortness of breath, cough, and chest tightness. Next are vital signs, assess the patient's breath sounds, the peak flow, the pulse oximetry, and vital signs to evaluate the severity of the symptoms and identify any signs of worsening asthma. Next is to provide asthma education, such as breathing exercises and medication education. So breathing exercises teach the patient different types of breathing techniques such as the pursed lip breathing and diaphragmatic breathing to improve airflow and reduce the patient's anxiety. For medication education naman, provide comprehensive education on the proper use of asthma medications, including inhalers, nebulizers, and oral medications. Now we will proceed with the nursing prevention. So these several nursing preventions are aimed to prevent asthma exacerbations and improve the overall outcomes of our asthma patients. So first is the trigger avoidance. So identifying or avoiding the specific type of triggers can reduce the frequency and the severity of the asthma attacks. Remember that the common triggers of asthma attacks includes allergens such as dust mites, pollen, mold, pet dander, irritants such as smoke, air pollution, and respiratory infections. So always help patients identify their personal triggers and develop strategies to minimize their exposure to those type of triggers they are involved in. So this may involve using air purifiers, avoiding exposure to allergens, and taking precautions during allergy seasons. Next is vaccinations. So influenza and pneumococcal vaccinations can help protect against respiratory infections, which can exacerbate asthma symptoms. So encourage your patients to receive annual influenza vaccinations and pneumococcal vaccinations as recommended by their healthcare provider. Next naman is stress management. So stress can trigger asthma attacks as well, or it can also worsen their existing symptoms. So effective stress management techniques can help reduce the impact stress of asthma. So teach patients different types of relaxation techniques, such as deep breathing exercises, meditation, yoga, or to manage stress and anxiety. Then lastly is the emergency preparedness. So developing an emergency plan for asthma attacks can help you ensure prompt and appropriate action in case of a severe exacerbation. So the emergency plan should include contact information for emergency services, a list of asthma medications, instruct for seeking immediate medical attention as well. So by implementing these nursing preventions, healthcare professionals can help patients with asthma take proactive steps to prevent exacerbations and reduce the need for emergency care. Next is the prognosis of asthma. So as the slide states, asthma is a chronic condition that can be managed effectively with appropriate treatment. While there is no cure for asthma, many people with the condition can lead normal, active lives. The prognosis for asthma depends on several factors, including the severity of asthma, access to healthcare, and environmental factors. So the prognosis of asthma varies among individuals. With proper management, many people with asthma can live actively. So it is important to note that if asthma is not well managed or if severe exacerbation occurs frequently, it can lead to status asthmaticus, which is a life-threatening condition. The next reporter, Ms. Mercy, will discuss what is status asthmaticus, its pathophysiology, clinical manifestations, and nursing management of this specific disease. That is all for my part. Again, I am Kelly Martinez. Thank you for listening.
Good day everyone, I am Researcher Susie from BSN 2B and today I will be discussing the status asthmaticus. So first is what is status asthmaticus? So status asthmaticus is a severe life-threatening exacerbation of asthma that does not respond to standard treatment and require immediate medical intervention. It is characterized by prolonged bronchospasm leading to significant airway obstruction and respiratory distress. Also, status asthmaticus is an emergency condition that can occur in patients with asthma, particularly in those with poorly controlled disease. It can be precipitated by various factors, including the allergens, infections, and the environmental stressors. So, the prevalence of the status asthmaticus varies, but status asthmaticus affects a significant minority of individuals with asthma, particularly in children and those with a history of severe asthma exacerbations. It is a leading cause of emergency department visits and hospitalization for asthma. An estimated 3% to 16% of hospitalized adult asthmaticus patients progress to respiratory failure requiring ventilator support. Then next is the clinical signs and symptoms for status asthmaticus. And the clinical symptoms include severe shortness of breath, chest tightness, and wheezing that can be prolonged or even disappear as the condition worsens. A patient may use accessory muscles like the neck and the shoulder muscles to help breathe, showing how much effort is required just to take a breath. Then next is the rapid breathing or the tachypnea, and the fast heart rate or the tachycardia are also common as the body tries to compensate for the lack of oxygen. Then the cyanosis, which is a bluish tint to the skin, might appear in severe cases due to the oxygen levels. Then the altered mental status, such as the confusion or the lethargy, and this occurs when the brain doesn't get enough oxygen. Okay, let's proceed with the pathophysiology of the status asthmaticus. There are two factors, the modifiable factors and the non-modifiable factors. The modifiable factors, these are factors that can be changed or controlled to reduce the risk of the status asthmaticus. The first factors, the medication non-compliance and this failure to adhere to prescribed asthma medication regimens, including both preventive and rescue inhalers, can result in uncontrolled asthma and increase the risk of the severe attack. Second is the environmental irritants. Exposure to pollutants, smoke, strong odors, and chemical fumes can irritate the airways and precipitate severe asthma exacerbations. Third is exercise-induced bronchoconstriction. This intense physical activity can trigger asthma symptoms in some individuals, leading to a status asthmaticus if not managed properly. The next is the stress and emotional factors. Psychological stress and strong emotional responses can worsen the asthma symptoms and contribute to developmental of the status asthmaticus. Then, the certain medication. So, some medications such as non-steroidal anti-inflammatory drugs and beta blockers can trigger asthma exacerbations in sensitive individuals. The next is the gastroesophageal reflux disease. This is the acid reflux can cause airway inflammation and trigger severe asthma symptoms. Then lastly, the weather changes. So sudden changes in weather, particularly cold air, can aggravate asthma and lead to status asthmaticus. The non-modifiable factors, these are factors that cannot be changed or controlled, but they can increase the risk of developing status asthmaticus. The first factors is the gender. Women are more likely to experience severe asthma symptoms as adults, potentially due to hormonal changes during the menstrual cycle. Then second, the ethnicity. Individuals of African American and Hispanic descent have been shown to have higher rates of asthma and are at increased risk for severe potentially fatal asthma attacks. The next is the birth problems and early life. Low birth weight, complications during birth or pregnancy, and inadequate vitamin D intake during pregnancy can increase the risk of developing childhood asthma. Then lastly, the family history of asthma. A family history of asthma significantly increases the risk of developing the condition due to genetic predisposition. So the status asthmaticus is a severe life-threatening exacerbation of asthma. So there are triggering events. So the process often starts with a triggering event such as infection, allergen exposure, or irritant. So this leads to inflammation and bronchoconstrictions in the airways. Then the inflammatory response, the body's immune response will trigger causes inflammation in the bronchial tubes. This inflammation leads to swelling and increased mucus productions, which narrows the airways. Then the bronchoconstriction. So the smooth muscles around the bronchial tubes contract, causing bronchoconstriction. So this further narrows the airways and makes it difficult for air to pass through. Then the hypoxemia, as the airways narrow, less oxygen is able to reach the lung, leading to hypoxemia or the low oxygen levels in the blood. In hypercapnia, the reduced airflow also make it difficult to expel carbon dioxide, leading to hypercapnia or the high levels of carbon dioxide in the blood. And it causes respiratory distress. The combination of hypoxemia and the hypercapnia causes respiratory distress, which can progress to respiratory failure if not treated promptly. So in the compensatory mechanisms, the body tries to compensate by increasing the respiratory rate and using accessory muscles to breathe. But these mechanisms can become overwhelmed that causes potential complications. If not managed effectively, status asthmaticus can lead to complications such as pneumothorax or the collapsed lung, the respiratory arrest, and even death. Then next is the love and the diagnostic exam for the status asthmaticus. First is the pulmonary function test. It demonstrates a significant airway obstruction. Next is the peak expiratory flow rate. It often less than 50% of predicted. Then next, the arterial blood gas may show hypoxemia, hypercapnia, and respiratory acidosis. Then lastly, the chest X-ray. It is to rule out other conditions like pneumonia. Then the medical and the surgical management. The medications, the short-acting and the long-acting beta-agonists. These bronchodilators help relax the muscles around the airways, easy breathing. Then the systemic corticosteroids, these reduce inflammation in the airways. Then the leukotriene modifiers, these help prevent inflammation and bronchoconstriction. Then the emergency interventions include the intubation and the medical ventilation. It is used if the patient goes into respiratory failure, ensuring they get enough oxygen. Then the surgery, bronchial thermoplasty, it is really needed but can be considered for cases that does not respond to other treatment. This procedure involves heating the inside of the airways to reduce muscle mass and prevent constriction. The nursing management for status asthmaticus, first is monitor vital signs and oxygen saturation closely. Second, administer prescribed medication and treatment. Third is provide emotional support and education to patients and families. Then educate on proper inhaler techniques and the importance of adherence to mitigation regimens. Then lastly, prepare for potential escalation of care if the patient's condition deteriorates. Then the prevention for first is the identify and avoid triggers like allergens, smoking, and respiratory infections. The regular follow-up with the healthcare provider to manage asthma effectively. Next is adherence to prescribed asthma action plans and medications. Then lastly, patient's education on recognizing early signs of exacerbations. Then the prognosis for individuals with status asthmaticus varies based on the timelines of the intervention, severity of the episode, and underlying asthma control. With prompt treatment, most patients recover. However, recurrent episodes can lead to long-term complications, including respiratory failure and decreased quality of life.